Thank you very much. Good afternoon, everybody, and thank you to GBCHealth for having us here. It's a pleasure. This spotlight is about how the private sector engages with GAVI and our mission and why. And GAVI's mission is to save lives and protect health by increasing access to immunization in poor countries. Or a different way of putting that is that the vaccines that historically have been available principally to kids in rich countries, we're trying to ensure are available to kids wherever they're born on the planet. This is an important task because still today, a child dies every 20 seconds from a vaccine-preventable disease. That's 1.7 million kids a year who die needlessly, principally in developing countries. So in GAVI's first decade of existence, we've managed to help immunize 326 million kids around the working in over 70 of the poorest countries on the planet, and in the process helped to save 5.5 million lives. Our current drive and our current challenge is over the next 4 years through to the end of 2015 to immunize another 250 million people, and in the process help to save 4 million lives, 4 million additional lives. Now, the private sector is critical in helping us to achieve this mission, critical in assisting us with funding, critical in assisting us with advocacy and spreading the word, and critical in bringing core business expertise into what we do and the significant challenges we have in doing it. And to that end, in June of 2011, we launched a product called the GAVI Matching Fund. It's a simple product, but about which we are extremely excited. What happened was that the UK government and the Gates Foundation made available to us a challenge grant of $130 million. And for every corporate donation that we receive to GAVI, or every private foundation donation that we receive, that matching fund will match it dollar for dollar. So any donation that we get from the private sector is effectively doubled immediately. Not only that, but if as a company or a foundation you can go out to your employees, your customers, your members, your business partners, tell them about immunization, about GAVI, and get some money from them, the matching fund will double that as well. So it's a fantastic product, and so far I'm delighted to say that we have 6 wonderful partners already on board and talking to many others. And 2 of our partners are sitting here right next to me. So we have Brink from Anglo American and Diane Whitty from JP Morgan. And I'm going to hand over to them now by asking them a couple of questions, starting with Brian and then moving on to Diane. And I wanted to start off by asking you both just about your motivations for becoming involved with GAVI and for becoming involved specifically with the GAVI Matching Fund. So over to Brian.
So this time you might say, well, what's that got to do with mining? And, well, the answer is simple. Some 90% of our mining operations are in developing countries. And we work there, and we see day to day the burden of disease. And we see what that disease does to impede development, impede economic growth, and just make it much more difficult for us to do our job, to run a successful business in those developing countries. So we want to deal with the burden of disease. We want to invest in health. Where's the best place to put your money? Bill Gates has answered that for us. He knows that putting it into vaccination gives you one of the best returns on your investment that you can possibly get. So that was one really good reason. The other is that GAVI is a very close cousin of the Global Fund. It's also one of these new public-private partnerships that's got an entirely new model for getting governments and private sector and civil society to all come together and deliver something that really will make a difference around the world. So that was another good reason. You've heard me talk a lot about the Global Fund. What was exciting about this one was the UK government coming in and saying, we will provide the matching fund. So we're going to double up everything that you bring, and that was an extraordinary opportunity. I would love that they would do that for the Global Fund too. But so far, for GAVI, and good luck to GAVI, they had a very successful replenishment, and they really are going to get on and deliver some fantastic things. And so for us, we're delighted to be one of the many businesses, David, that are going to join in this thing. And then, the next big thing was the UK government piece through DFID was for companies based in the UK. The Gates Foundation stood up and said for companies outside of the UK, we're going to provide that same matching. So for those who say, well, we're not in the UK, Gates to the rescue.
No place to hide.
And so we're looking for the next many companies that are going to come and do this as well.
Thank you very much, Brian. Diane?
Yes. First of all, and David doesn't know this yet, the journey with GAVI actually began about a year and a half ago when we partnered with the Gates Foundation and we held a global summit on health at our world headquarters here in New York. And we had in our summit all of our clients from the high net worth to the ultra high net worth clients attend that. And Melinda Gates was with us for the first hour. And she shared with everyone there the journey that she and Bill went on as they were thinking about their foundation and where they were going to go. And this was a great opportunity for educating our clients in and around a global health. And at the same time, we had a panel discussion. And on that panel was Leith Greenslade, who was then very involved with GAVI, and we really began to educate ourselves in and around vaccines. Now, for myself, I had already been educated after having spent 15 years in combination with Save the Children and UNICEF. So needless to say, I was more than delighted to have this happen. So when GAVI approached us, they approached us at a time when we really understood the work that they were doing and the difference that it makes. And quite frankly, GAVI does embody all of the values that we employ as an organization because they're so focused. Everything that they're focused on is doable. The organization is outcome-oriented, and what they do can be measured. You also have to look when you're working with GAVI that the investment that you're making really does stretch because they are able to drive down the cost of vaccines, and in a way, when you're working with GAVI, you're able to leverage all of that and immunize more children. So from a philanthropy and philosophical perspective, in working with GAVI, we find for ourselves, number one, of course, we are saving children's lives. I remember when I first started with Save the Children and then with UNICEF, 34,000 children were dying every day from preventable diseases. Today, UNICEF estimates that that number is down to 21,000 children a day, a huge decrease in child mortality, and most of that is really due to the fact that we have engaged in this war and we are able to deliver vaccines to those who need it through GAVI. The other reason here, David, is that I have to say the UK government made a very compelling case when they approached us with what I consider to be a great opportunity for us to be able to contribute this. And then for myself, with my background, when I hear matching funds, I don't know if anyone out there is in fundraising or development, but that's what I did for 15 years, and I hear matching funds, and it's magical because of the leverage that you can get. So the 1.5 million pounds that JP Morgan invested in GAVI grew to 3 million pounds. We were able then also to target where that money went, and we were able to actually realize in a relatively short period of time, 440,000 children in Ghana were immunized. And by any stretch of the imagination, for that to happen so quickly and to be able to save 440,000 lives in a relatively short period of time, for us made the investment more than worth it. And lastly, but certainly not least, I think it's a wonderful opportunity for us to be involved with GAVI. We consider it to be one of the great innovative and more successful public-private partnerships that we all have the opportunity to be involved in.
Thank you very much for those kind words, Diane. I spoke earlier about the ability to bring in employees, business partners, members, etc., customers. One of our other partners, La Caixa Bank in Spain, has been reasonably successful about going out to, has been very successful, I should say, about going out to employees and customers, getting money from them, and then having that matched. I know Anglo American has just started down that road in the last few months. I wanted to ask both of you, starting with you, Brian, I mean, what do you see the potential of involving your stakeholders out there in the product?
David, we just think that they have the same issues as us. They're supplying us, and they're supplying into developing countries. And if we see the need, we think some of our bigger contractors will certainly, we spend billions of dollars with those contractors. We think that they would understand the issues in the same way as we do. So we can use that influence of our business directly, you know, with the people that we deal with on a day-to-day basis, more indirectly through GBCHealth, organizations like this, where we all come together and share our experiences and get a better understanding of the way in which business can make a difference. I think, again, for us, we have great faith in GAVI, the extraordinary results that you achieve. Once we've given you the money, we don't even have to think about it anymore. We just leave it with you, and you get the job done. You give us a report at the end of each year, and we see the difference being made. So it's, you know, I think we'll persuade our suppliers.
We appreciate that.
Yeah, I think from my perspective here, just so you all know, within the private bank sits what is called the Philanthropy Center at JP Morgan. And what we do is we work with all of the clients in the private bank in and around their philanthropy. So we advise individuals, we advise the principals on their philanthropy, whether or not they're establishing a foundation. We work with them on their areas of focus, helping them write mission statements, beginning to educate them about the role of a grantor and a grantee. We also work with them in and around their families. So we have an opportunity to really help them advance their philanthropy, as well as hold thought leadership summits like we did on global health. Last year, we focused on education. So our opportunity and the work that we do enables us to be talking about the great work of GAVI, the work that it does, what they hope to accomplish. And we're hoping to expand that even further as we go into 2013. We recently, because we're such a global company, we recently had, we were very fortunate that the Secretary General of the UN was traveling to Asia and spent time in Mumbai, India. And therefore, in there, his whole focus was on every woman, every child, which of course encompasses the work of GAVI. And we now have executives who are going to sit on a leadership council in and around the work that needs to be done in India. But more importantly, we were then able to expose our clients to that work, and we will continue to do that because we believe that as we're educating and exposing our clients to the work of GAVI, it will naturally lead to more involvement in the work and creating greater leverage and greater donations to the matching fund, which we love.
We really appreciate that. We're out of time, so thank you to all of you. Thank you to GBCHealth. Thanks, Brian, and thanks, Diane.
Thank you very much.